Welcome to UMCC Medical Consultant Connectors, where your health matters to us. A groin injury, or groin strain, occurs when the muscles in the inner thigh are stretched or torn. These muscles, known as adductors, are responsible for bringing your legs together. Groin injuries are common in sports that involve a lot of running, kicking, and quick changes in direction. Athletes in sports like soccer, hockey, and football are particularly susceptible. However, anyone can sustain a groin injury from activities like dancing, gardening, or even slipping on ice. The severity of a groin injury can vary. A mild strain may involve a slight overstretching of the muscles, while a severe strain can involve a complete tear. The location of the injury can also vary, affecting different parts of the adductor muscle group. Understanding the nature of groin injuries is the first step towards effective prevention and treatment. Groin injuries typically happen when the adductor muscles are suddenly and forcefully stretched beyond their limits. This can occur during activities like sprinting, kicking, or changing direction quickly. Imagine a soccer player making a quick turn to chase the ball, or a dancer doing a high split leap. These movements can put significant strain on the groin muscles, especially if they are not properly warmed up. Overuse or fatigue is another common culprit. Repetitive motions, like those in running or swimming, can gradually wear down the adductor muscles, making them more susceptible to injury. Muscle imbalances, where some muscles are stronger than others, can also increase the risk. This imbalance can put uneven stress on the groin muscles, leading to strains. Groin injuries often announce themselves with a sharp, sudden pain in the inner thigh. This pain might be felt deep in the groin or even radiate to the lower abdomen. The pain is usually most intense at the time of injury and gradually subsides. However, it can linger as a dull ache, especially when you try to move your leg. Along with pain, you might experience stiffness and limited range of motion. Simple tasks like walking, climbing stairs, or getting in and out of a car might become difficult. Swelling and bruising around the groin area are also common signs, indicating inflammation and potential damage to the muscles. In some cases, a popping or snapping sensation might accompany the injury. Section 4. Diagnosis and treatment. If you suspect a groin injury, it's essential to consult a healthcare professional for proper diagnosis and treatment. They will start by asking about your medical history and how the injury occurred. A physical exam will follow where they assess your range of motion, tenderness, and strength in the affected leg. Imaging tests like an X-ray or ultrasound might be ordered to rule out other conditions like a fracture, or to get a clearer picture of the muscle damage. Treatment for groin injuries typically follows the RICE protocol: rest, ice, compression, and elevation. This helps manage pain, reduce swelling, and promote healing. Section 5. Prevention and safe return. Preventing groin injuries involves taking proactive steps to strengthen and protect your adductor muscles. Start with a proper warm-up before any physical activity, incorporating dynamic stretches like leg swings and torso twists. Regular stretching exercises such as butterfly stretches and side lunges can improve flexibility in the groin muscles. Strength training is crucial for building muscle resilience. Exercises like squats, lunges, and adductor squeezes can help strengthen the groin muscles and improve their ability to withstand stress. Remember to use proper form and gradually increase the intensity and duration of your workouts. Listen to your body and take rest days when needed. UMCC, your ultimate medical consultant connectors.